So right now, as you know, big topic out there is, should I work for DSO? Should I work for private practice? Ultimately, should I own my own private practice, or should I sell my practice to a DSO and then continue working with them? So I want to explain the differences here, and then that'll help you make a better decision when the time comes. So working for a DSO as opposed to a private practice comes with various pros and cons. Ultimately, the decision of what's right for you is going to come down to what your goals are, right? What is it that you're looking for? What's your personality like, and what do you like to do? What don't you like to do? So one of the pros of working for DSO is financial stability. For those of you that are in practice for yourself, if you started from the ground up, you know how tough that first year or two is. You might not even be drawing a paycheck out of your practice, and you're hopeful and losing sleep at night, hoping you're going to get your practice to profitability and then eventually be successful and make really good income. When you work for a DSO, it's like working for a company, because you are, and you're going to get a W-2, so it gives you more financial stability. The other advantage is less administrative work. So if you want to treat your patients, go home, and not really worry about much, then a DSO might be the better way for you to go. If you do want to be an entrepreneur and really be your own, in control of your own destiny, then going into private practice is going to make more sense for you. The other advantage of working with the DSO is access to the latest technology. If you work in a small private practice or own your own small private practice, generally speaking, you're not going out and buying that brand new state-of-the-art, $100,000 piece of equipment every other year. DSO, typically, they have deeper pockets, and the latest technology may be available to you, where somebody in private practice may not have that. The other advantage is the opportunity for mentorship and collaboration. So if you're a younger dentist just starting out, you'll have the opportunity to work with other dentists, maybe more experienced dentists, and or the fact that if you want to take a week off for 2 weeks to travel to Europe, you might have a clearer head because there'll be somebody there to cover your patients. So that's definitely a positive to being associated part of a dental service organization. So what are some of the cons? The cons are limited autonomy. So with a DSO, you as the dentist, you have fewer rights and a lot less control. You may have a very high standard of your own of what you believe you should be doing with the patient, what level of service you want to give them. Maybe you have a high level of ethics and you feel, I don't want to be forced to sell them a dental procedure they don't need if they really don't need it. Working for DSO, sometimes they push you because your compensation is tied to what you sell and what you provide. So some people look at that as a big negative. Also, when we talk about control, it's not only about the level of service, but let's say you want to work just 4 days a week or 3 days a week. When you work for a DSO, they pretty much dictate the hours because you're an employee. Although you can make a very good income working for DSO, your potential to make very high income is definitely more with a private practice. Generally speaking, a dentist who works for another practice, depending on what their specialty is, they could be getting paid 35% of collection, 40%. If you're a specialist, I've seen specialists get paid 50 or 55%, which is great. That's definitely a good thing. The big thing is when you work for DSO, even if they're compensating you well, one thing you're not doing, you're not building equity, right? That practice, you could work for 40 years in a dental practice. When you're ready to leave, you're not going to get paid for the value you built for the other owner of that practice because you're not an owner. You could be an owner if you sell your practice and merge it into a DSO, because many of those deals are structured where the dentist is required to stick around for at least 5 years. And then we've had many cases. My son does a lot of work with dental DSOs, both the buy side, the sell side, and we've seen a lot of interesting deals over the years. Generally, what we do is we tell our clients, build a successful dental practice, make it as profitable as you can, run that practice for many years as you can and you feel comfortable with, but roughly about 5 years before you're ready to retire, that generally is the best time to sell the practice. You don't want to sell your practice, let's say you're doing $5 million a year and you're slowing down every year, cutting from 5 to 6 to 3 days a week, and now you're only generating $1 million a year because you just threw away $4 million of potential equity. So it's important to know the timing of when you're going to sell your practice down the road to a DSO. The other thing here is loss of many tax benefits. Many of the tax benefits we're going to speak about today are going to basically not be available to you when you work for a DSO, because a DSO, they don't think as an entrepreneur does. They don't think the way somebody that owns their own practice does. We want to maximize every single tax deduction we could get because we want to pay as little tax as possible to the government. We want to take control of certain deductions, and there's the dark area, let's call it the gray area, in between the black and the white area. We want to be able to take advantage of that gray area and deduct things that under a DSO structure, they're not going to let you deduct. The reason for that is because with a DSO, they focus on EBITDA. EBITDA basically stands for earnings before interest, taxes, depreciation, and amortization. What does that mean? They're not looking for tax smart strategies because they want to show as much profitability as possible. They don't care about paying the taxes. Why is that? Because the higher the EBITDA, the more profitable they seem. What happens? The valuation of that DSO is significantly higher. And now when they go to sell the DSO, maybe to a publicly traded DSO, they're going to get big bucks. And all the DSO providers, why are they doing what they do? They're not doing it to provide the best possible dentistry in the world. They're doing it for profit motives and strictly profit motives. And again, there's nothing wrong with that because making a profit is what it should all be about, but you have to ask yourself, is that really right for you? The trend that we've seen is that more and more DSOs in the early days, they were looking for older dentists looking to leave. And in the beginning of DSOs, typically the dentist himself or herself, they didn't even stay with the practice. Now they're targeting DSOs, younger dentists, because they're trying to get them early on when they just started their practice and maybe struggling and they're not very profitable. Now, why do you think they're doing that? Because they know they can buy that practice cheap. So let's say they buy a practice that's only doing $1 million, but they know that practice has the potential to do $10 million in revenue. Who's now getting the benefit of a practice that is now worth $10 million? It's going to be the DSO. So I don't have a problem with that. Again, business is business, but you got to look out for your interests, what's best for you. Also, even if you're an older dentist, let's say in your 50s, 60s, maybe even 70s, some dentists, they never want to stop working until they literally can't do it anymore. But even if you're an older dentist, one of the things DSOs now require, it's almost always mandatory, you got to stick around for at least 4 to 5 years. And again, this is why we always say, if you're planning to retire at 65, take your practice to the peak by the age of 60. If you want to sell to the DSO, you're comfortable with that at that point, do it. And then they'll keep you on for 5 years during that whole practice transition stage.